Welcome to this Vodcast on writing multiple choice questions created for the WGO Train the Trainer program. By the end of this module, you will be able to design multiple choice questions based on the test taker level and the stakes of the activity, list the components of a multiple choice question and describe how to avoid common pitfalls in writing, and analyze the results of multiple choice questions in order to improve the quality of your exam. It is important to recognize what is at stake. Is this for board certification or passing of a class or clinical rotation? Is this a knowledge assessment, or is the purpose of the MCQs solely to generate discussion? In general, exams can be formative evaluation, which is low stakes and is used for learning, or it can be a summative evaluation, which is higher stakes, pass or fail. Therefore, should be a more accurate and reproducible exam. For a course, it is important that the exam questions align with the course objectives. A standardized exam should match the targeted learner level, and you may want to create an exam blueprint which outlines the content of the course and the relative weighting of topics on the exam. MCQs enhance learning, and if properly written, can examine higher levels of learning according to Bloom's taxonomy, beyond knowledge where you just are required to remember facts. When preparing the exam blueprint, remember to ask more questions on frequently encountered problems, including atypical presentations of common problems. But it is also important to include testing of uncommon clinical problems that can't be missed because they're life-threatening. But if testing on rare diseases, you should only include classical presentations. In general, MCQs should be single best answer, which follows a clinical scenario. You should avoid matching unless it is extended matching, true or false questions, and multiple choice questions where there are multiple correct answers. What are the components of a multiple choice question? First, you must start with the objective of the question. This is followed by a clinical scenario, which is known as the stem. Next, ask the question, which is known as the lead line, followed by your options. You need to identify the correct answer, and it's a good idea to provide a justification for the correct answer and an explanation for why the distractors are not correct. When writing an MCQ, first determine the objective and then create the lead line and options before you draft the stem. Finally, if this is needed, add the explanation. The objective should be succinct and specific about what clinical skill is to be tested. It is important to use appropriate action verbs like recognize, diagnose, treat, and manage, and avoid vague verbs such as understand or know. Remember to align with the overall objectives of the course. The objective should include a verb, the topic, and a model. Here's a useful list of action verbs which can be used to test across Bloom's taxonomy from knowledge to evaluation. Listed here are examples of good objectives. Select appropriate testing needed before beginning a biologic agent in a patient with inflammatory bowel disease. Evaluate for splenic thrombosis in a patient with isolated gastric varices. And identify peptic ulcers with stigmata for rebleeding that require endoscopic therapy. The lead line should be generic and ask for the best next step or the most appropriate management. You should allow for diagnostic and therapeutic options. It's important to avoid syntax and grammatical errors, and make sure that a correct answer can be provided. Importantly, do not write a lead line that makes the stem unnecessary. The most commonly used lead lines ask you to identify the next most likely diagnosis or the most appropriate next best step in the management. You should avoid lead lines with all of the following except, which is the least likely, and which would you not do. The options should have 4 or 5 answers, but don't add a 5th if it's not a reasonable option. There should always be one correct answer, but the other options should not all be 100% wrong, but there should be a spectrum of less plausible answers. You should avoid mutually exclusive options. Make sure that you are only testing one concept at a time. And try to keep the options the same length and complexity. The STEM should be provided in the same order as taking a history. Start with the demographics, the location of the clinical encounter, and the chief complaint. In the medical and social history, provide relevant information and include distractors that make other answers reasonable options. Finally, provide the physical exam and the relevant investigations. Remember to provide enough details, but avoid too much extraneous information. If the STEM is long, make sure you allow for appropriate time for the exam, and it's useful to organize the labs and other results in tables. The explanation, first explain why the correct answer is the right one, and then explain why the other answers are incorrect, and this is done in alphabetical order. Finally, how do you know if you have written a good multiple choice question? You should aim for 50 to 80% of the exam takers to get the answer correct. A range of 40 to 90 can be allowed, but if it's less than 40% get it right, the question is too hard. And if more than 90% get it right, the question is too easy. There are programs that report how the top exam performers compare to the bottom exam performers on individual questions, answering how well does the question discriminate. This will be demonstrated further in the workshop. So in summary, when writing multiple choice questions, you must know your learner level and remind yourself about the overall objectives of the test. Write the MCQ objective first, and then the lead line and options before you create the STEM. Add an explanation if needed. You should avoid errors in writing MCQs and evaluate how well you have done.